Our students get a lot of clinical experience. They do a lot of hands-on work with the patients. They're in clinic 4 days a week, so they're actually doing x-rays. And even within the first 6 weeks of the program, they've already started doing x-rays on actual patients. There's lots of jobs once you become a radiologic technologist. So the obvious job is working in a hospital or an imaging center, but there's a lot of other directions that you can go as a radiologic technologist. You can work in doctor's offices, you can go actually to any of the modalities in work like CAT scan, MRI, even ultrasound and nuclear medicine. In addition to that, you can work in the computer end of imaging. Obviously with imaging we use a lot of different kinds of computers and we need people to maintain those computers and work with the software. You can go into education, like I did. You can go into sales of equipment and work for manufacturers of imaging equipment. So there are lots of ways that you can go once you become a radiologic technologist.